So in the past, let's say, I mean, what we did as surgeons, we looked at 2D images and tried to stack it up in our mind and say, well, this is really what it's going to look like when we actually are in surgery. You'd have to take a plain film or an X-ray or something and try to imagine what it would look like. Here, the critical thing is we're able to take the patient's own images from tests we get all the time, whether it's an MRI scan or a CT scanner, and put it into 3D. We put on special goggles and we're able to see in 3D, just like everyone does at the movies now. So you actually can rehearse and look through the patient's own anatomy. The very thing that I'm going to see tomorrow inside that patient's head is what I can look at on the screen. And not only that, I can manipulate it, I can plan what I'm going to do. So if I'm going to treat an aneurysm or treat a tumor, I know what it looks like, I've seen the approach I'm going to use, I know what's behind it, what to beware of, and it makes me that much more prepared to deal with the surgery. It's one thing to have a 3D reconstruction, but what we have to get Alon to do is make sure that the system reacts to me. So as a surgeon now, I'm not only seeing it, but I'm changing the system. You see I'm putting a clip in. This is what I'd be doing at surgery, so my hand will mimic what I do. And as I go by the blood vessels, you see they move a little bit, which is what they normally do. And if I move them too much, obviously they'll rupture. But now I have the clip in good position, and now I can start to close it, and you can see the aneurysm changing shape. The neck gets smaller as it gets closed off. And that's what it looks like just when we do it surgery. And then the aneurysm finally closes. So what I've done now is I've placed the aneurysm clip. And you can see it in place here, pinching off the neck of the aneurysm. What I want to know is, have I left the normal blood vessels open? Because one of the mistakes I can make is closing off this blood supply to the normal brain instead of just to the aneurysm. Well, at surgery, I'm sort of stuck looking at it here or wondering, or if I were just to practice in my mind's eye, I wouldn't be able to know what I'm doing. But here I can actually take the scene, rotate it completely, and say, look, now I can see that the aneurysm is closed off, this blood vessel is open, this is open, and the clip is beyond the aneurysm neck, which is exactly what I want to do. This is almost a scene that I can't even see at surgery because I'm not able to really rotate the scene 360 degrees like I can here. So you can see now we're looking from the back side of the aneurysm and able to inspect it completely, and I can say, wow, if I put the clip on just like that, I'll know I've put it in the right place and I've done my job. And again, if I don't like it here, I can always rehearse it and take that off again. But this is an incredibly valuable tool to be able to say that I've done what I set out to do, which is close off this aneurysm, but keep the normal blood supply to the brain where the arrows are going intact. Really what you have to do, you have to make it feel like I'm really operating, because unless I feel the stress of operating, I'm not going to learn quite as well. And so what the engineers have been able to do is make the tissue move the same way it would move if I touched it with an instrument, to make the aneurysm rupture if I treat it in a wrong way. And so this makes me know that I'm really doing what I'm going to do tomorrow. And if I make a mistake, luckily I can practice it outside the OR, get those mistakes out of the way, and make sure that I'm dealing with perfection when we deal with surgery. Well, I think let's think about what the physician wants. The physician wants the best outcome for their patient, and so this provides that type of ability for the physician or the surgeon to rehearse, to what we call pre-live the future. So you'll have the opportunity to practice what you're going to do for very critical missions. Instead of practicing it in the OR or remembering what you did on a previous patient, you can actually practice on what you're going to see tomorrow. So it allows you to develop all the things that athletes have known about, muscle memory. It allows you to react to situations that may crop up. And so really what we're trying to do is say that what the physician or the surgeon cares about is the patient outcome. This allows us to improve patient outcome. What is necessary for the patient to have a good outcome, or what is necessary for a patient to have a benefit from this technology, is very simple. So if I know what I'm going to deal with at the time of surgery, in other words, if I have rehearsed it before, then I am better able to do that same maneuver only when it counts, when it's actually in the gameplay. So the benefit to the patient is that I'm not experiencing something that's unfamiliar to me. I'm experiencing something that I've practiced, and it doesn't take me a very long time to practice it, and I'm practicing on what is actually their problem. I'm not practicing on a general problem, say tumors in general or aneurysms in general. I'm practicing on exactly what I plan to do tomorrow. So that allows me to be better at what I'm going to do.
The procedure that you are watching is in the microsurgical clipping of a cerebral aneurysm in a patient who was treated just a few weeks ago. Now, the first session is performed by a surgeon who does not routinely do aneurysm, and you'll see that the novice chooses a straight clip to secure the aneurysm. Now, what you're seeing here is really the approach to the aneurysm as defined by really exactly what we saw at surgery, the patient's own anatomy, and you can see the novice trying to put the clip on the aneurysm, and really we'll find out that that's not the best way to do it. The important thing is that we're able to see this and rehearse this. Now, what you're going to see is that when a surgeon tries to put a clip on an aneurysm, there's literally hundreds of clips to choose from, and the important thing is to be able to try to get that clip placed in a very short period of time so that we can avoid a stroke.
So this is what we've developed as sort of the proof of principle, because aneurysm surgery is one of the most technically demanding surgeries. So we've shown that we can do it on this type of surgery. We're also modeling it on other types of surgery, including drilling away bone at the base of a skull or taking out a tumor. There's many things that this can be applied to. Very complex open surgery is what we want to model. There's a lot of simulators out there that model very simple things, but that's really not what's going to help improve patient outcome. Well, I don't think anyone else is doing this sophisticated of modeling and allowing the surgeon really to pre-live the future. This also has the ability to form a collaborative theater, so the opportunities are very unique in that regard. In other words, I can have someone send me the images that is necessary, process it, and then go over with them. So if they're not as familiar with doing that technique, I can say, you know what, if you move the microscope just a little bit this way, you'll be able to do this much easier. You'll get a much better outcome. It'll be more familiar for you. So by rehearsing again ahead of time, I don't even need to be in the same city or the same state.